This is a demonstration of a HYDRUS implantation using an on-hand and off-hand approach. So here we're going to start with the on-hand, or the right hand for me, approach. And so I like all of my HYDRUS shunts to go on the inferior nasal angle, which is why I do flip sides. And so for this patient, I'm making that second in paracentesis incision. That's going to be for the HYDRUS insertion. I am a right-handed surgeon, so my phaco's in the right hand and my secondary instrument's on the left. So when I do the cataract, that initial para is on the left side. So here we tilted the head. We're bringing in the HYDRUS injector. At the beginning there, I was just showing you I like to preload that HYDRUS to where it's sitting right at the tip of the injector, and I also like to test it to make sure it's working. And so now that HYDRUS is tilted at about, a 15 to 20 degree angle. I'm going to make a small kind of swipe with the tip of the injector because it's relatively sharp. And so here, that's that swipe. And so that gave me just enough opening in the TM that I can press that HYDRUS just into that angle and then inject it. And so here, there's that full injection. You see that tooth fully open. And then I'm going to use the tip of the injector to actually rotate that HYDRUS further on into the canal. I like a little less of the HYDRUS poking out than most. I just don't want it to be causing any problems with the corneal endothelium, and so I do play it a little bit on the safer side and like that rotated in pretty deeply. And so here, that's usually about right where I like it. And now we're going to swap sides, and we're going to do my offhand, my left hand, because I'm a right-handed surgeon. And so here I can actually use my paracentesis that I created at the time of cataract surgery. It's in the right spot for me to use that HYDRUS, so I don't have to make a secondary incision. Again, testing the HYDRUS, making sure it comes out easily. Then I backpedal it just enough to where that HYDRUS is sitting just underneath where the bevel of that needle is. And so here, again, it's tilted up about 15 to 20 degrees. I'm going to make that small incision site. You can see how this is just a little bit more off. Again, I like that HYDRUS on the inferior nasal location specifically. And so again, this is my off left hand. I'm making that small incision site. I'm going to indent in, making sure that the tip of the injector is right in the canal. And then I'm going to forward pedal and inject the HYDRUS. And so here we can see it going in. There it's disappearing right into the canal. The HYDRUS is now fully open. You can see those kind of alligator teeth. And here I'm going to actually switch hands because it's just much easier for me to control the gonio prism and to further push that stent into the canal with my dominant hand. So here I'm back to my right hand, and I'm using a lens rotator, which really fits nicely right into the tip of that injector, and you can get a lot of control with that device. And so again, I like mine in just a little bit more than most, and so I'm going to kind of finick with this until it's right at the spot that I like, which is right about there, and now we're done. And so that's a nice example of the on-hand and off-hand approach, and in my opinion, makes you a better surgeon if you can do it with both hands.